the Medical Watch here as we mark the 4-year date since the first COVID diagnosis here in Illinois. Some perspective on the impact.
Our medical reporter, Dina Baer, is here with that. Dina?
Ben and Lourdes, just today, 2 separate studies pointed to troubling obesity rates and heart disease post-pandemic. 4 years after lockdowns, record hospitalizations, and lingering illness, Director for Infectious Disease for Ascension, Illinois, Dr. Dana Weiss, joins us to talk about the pandemic and beyond. Thank you for being here.
Thank you for having me here today.
So, one of the first Illinois patients was at your hospital at Ascension. Looking back now, with all you know, all you've learned, what can you tell us?
Well, 4 years seems like yesterday, or maybe a lifetime, depending which way you look at it. It was exciting, it was concerning, it was hard. We had so many challenges, and we've overcome so many challenges. I think for us, we always like to know what's going to happen. We like to predict outcomes. And with that first COVID patient, we hoped we knew enough, and we hope we have enough to deal with whatever might come. And COVID has challenged that over the past 4 years. We're definitely in a better shape now in terms of our knowledge, in terms of our surveillance system, and in terms of our treatments and our herd immunity to severe disease due to vaccination.
For us now, of course, we're not reporting on it every day, but for you, what is it like? How many cases are we seeing now? And more importantly, are people getting as sick?
We are tracking community risk levels and community levels and hospitalizations weekly. It's part of our mitigation system in terms of those metrics. We're looking at inpatients now. Thankfully, we are on a downtrend. We peaked at the end of the year, and now there's a downtrend. We see way less mortality. Still, elderly are the most affected. Over 65 are the ones that are being hospitalized and with higher mortality rates. But we are in a better shape than 4 years ago.
So clearly, especially for older people, we need to talk about protecting ourselves. What are the current vaccination rates? Are people still getting those shots to protect themselves?
So our updated shots have a less than optimal uptake, because in general our population is about 20% updated with the COVID shots. Elderly have a higher uptake for that. The effectiveness of the vaccines in terms of severity of disease and preventing hospitalization is around 70%. And these are new studies that are coming out with real world data. So it's never too late to get your vaccine.
When we talk about that efficacy, are the new variants always a step ahead of our efforts to kind of thwart the virus that causes COVID?
This is a very nimble virus, and it has been surprising us over and over again. But we are building that wall of immunity against severe disease, and we've seen the protection at the population level with the shots.
I think because of that, people have gotten a little bit lackadaisical. Do you think we should be wearing masks now? How long do we isolate after we have COVID, and how long do we wear a mask?
So the current recommendations are 10 days from the onset of symptoms. We noticed that the peak viral load occurs a little bit later, to day 3 or 4 after symptom onset. We also know that masks do protect against spreading of COVID and other respiratory illnesses. So for the viral respiratory season, it is a very useful intervention in preventing transmission.
All right, Dr. Dana Weiss, thank you so much for your insight.
My pleasure.
Ben and Lourdes?
Thank you, Dina. Up next, a suburban high school basketball coach will